Good morning, friends. This is Dr. Tina coming your way. Thank you for being here with me. Please remember to subscribe to my channel, Glam Doc Tina. Today we continue our series, PMH Exam Review, and I hope everything I'm teaching here is helpful because it's doing this for free of charge. There is a twist to this post. If you are the first person to comment, subscribe, share, then you get a present from me. So remember to subscribe to my channel and let's move on. Dopamine pathway is very essential aspect of the PMH exam. You must understand where dopamine is located, the four pathways of dopamine, and how each of them affects antipsychotic aspect. And so let's move on. The types of dopamine pathway. So we have four types of dopamine pathway. These are Mesolimbic pathway, mesocortical pathway, nigrostriatal pathway, and tuberofundibular pathway. These four pathways are very essential to note and to understand how each of them affects antipsychotic medication we give to our patients, or when we give antipsychotic to our patients, what does it affect each pathway? You have to understand its location. You have to understand how dopamine are reduced or increased in this aspect, the deficits and the benefits. So let's go on. Why do you have to know the four-dopamine pathway as a PMHNP? Dopamine is a monoimmune neurotransmitter. It is produced in the dopaminergic neurons in the ventral tegmental area of the substantia nigra. There are five subtypes of dopamine receptor, D1, 2, 3, 4, and 5. The four-dopamine pathway plays an essential mechanism of action and also its adverse effects of antipsychotic drugs. So let's take this from the basics. So dopamine is located in several parts of the brain, such as midbrain, ventral tegmental area, and substantia nigra. But you have to note that I highlighted the ventral tegmental area of the substantia nigra purposely for the test. Its function, or dopamine function, is it affects the executive function, that is the frontal lobe. It makes people feel good. However, when there is an excess of dopamine in the brain, one begins to have schizophrenia, positive aspects such as hallucination, delusion, tics, addiction. They occur when there is too much dopamine. However, when there are deficit or when there is a deficit or decrease of dopamine, then one begins to have Parkinson's disease, such as rigidity, shuffling gaits. One begins to have schizophrenia, the negative aspect, such as apathy, anhedonia, which means loss of interest or such as loss of libido. One begins to have NMS, EPS, and ADHD. So it's very essential when it comes to dopamine to know its location for the test and what it does when we give patient antipsychotic medication. What effect does it have on the dopamine in each aspect of the brain, which is the dopamine pathway? When you give medication or antipsychotic medication to schizophrenia patients, what happens in the mesolimbic pathway? What happens in the nigrostriatal? What happens in the tuberofundibular? What happens in the mesocortical? And that is why it's very essential, because you have to note what happens to your patient when you give antipsychotic to your patient. Let's move on. The mesolimbic pathway. In the mesolimbic pathway, also known as reward pathway, is a dopaminergic pathway in the brain. The pathway connects the ventral tegmental area in the midbrain to the ventral striatum of the basal ganglia in the forebrain. So in the mesolimbic pathway, dopamine is transported from the ventral tegmental area, also known as VTA, to the nucleus accumbens. Over here, there are positive symptoms that occur, such as hallucinations, delusions, and that you must note where it's transporting the dopamine from and to, and also is it positive aspects of schizophrenia? You must note for the exams. Mesocortical pathway. Then again, I highlighted in red, which is very critical to note. It's lower levels of dopamine in this cortex. So when you take this cortex, it's opposite to the mesolimbic system, because mesolimbic, you have more of the dopamine. However, in the mesocortical, there is less. So when you take medication like antipsychotics, this level lowers more. The dopamine level lowers more, and that is why patients begin to exhibit more negative symptoms. So if you have noticed, most patients on antipsychotic medication, patients that come in maybe with schizophrenic, they are treated on maybe antipsychotic, and as time goes on, they begin to clear off these positive symptoms, such as hallucination begins to go away, delusions begins to go away. However, the negative symptoms, such as apathy, you see that they will have that straight face. It's like their serious face begins to show. That is what happens because there's too much lower levels of dopamine, or dopamine levels are reduced in this aspect of the pathway. So it's opposite to the mesolimbic. So VTA neurons project the cortex, okay, over here, and lower levels of dopamine are seen in this aspect, and therefore the patient begins to exhibit negative symptoms. Nigrostriatal pathway controls motor functions such as movements and all that. However, the blockade of D2 receptors of dopamine causes movement disorder. So over here, when you take antipsychotic medication, you begin to block the D2 receptors. Remember, we have dopamine receptors. It begins to block the D2. When this is blocked, you begin to exhibit symptoms like Parkinson's disease, rigidity, akinesia, dystonia. So this aspect, you begin to have symptoms of Parkinson. The tuberofundibular pathway is the fourth pathway of dopamine. So everything occurs in the hypothalamus, which is the anterior pituitary. So dopamine, in its sense, acts on the pituitary as an inhibitor of the prolactin secretion. However, when we take antipsychotic medication, there's a blockade of dopamine D2 receptors by these antipsychotics, such as risperidone. If you give risperidone to patients, then there's a blockade of dopamine 2 D2 receptor. And this is what happens. When this is blocked, it causes hyperprolactinemia in males and also females. So both of them can exhibit these symptoms. So when this is blocked, you begin to have other symptoms, which is the negative aspects of it. Symptoms of hyperprolactinemia include amenorrhea, galactorrhea, infertility, loss of libido, and erectile dysfunction. So it's very serious. And this is why we should know whenever we are given antipsychotic to our patients, it's essential to note these. So this is very important, dopamine pathway, to understand all the four pathways, understand where the action occurs, and what are some of the results. What are some of the things or the effects that happens? You must know this. These are some of my references, and again, I'm teaching from the PMH and P4th edition, the purple book. So if you have any question or comments, just state under the comments. And again, if you are able to comment, subscribe, share, and like, then I have a surprise for you. Surprise! The first person to comment on this PowerPoint, subscribe, like, and share will get the surprise.